Hello everyone, and I hope everybody is doing perfectly fine. So today we'll be discussing a rare lesion which we found in breast. The entity is crystallizing galactocele of breast. So to begin with the case history, let's see. A 25-year-old female patient, she presented with swelling in the right breast for last 2 years. And this swelling was noted by her when she was in third trimester of her pregnancy. And this swelling has gradually increased over the period of last 2 years. And this patient had swelling during pregnancy and throughout the lactational period. And she gave history of no trauma or any kind of serious or bloody discharge from the nipple. And on physical examination, what we got was a round to oval swelling. We noted this in the right breast in upper outer quadrant. The swelling was freely mobile, non-tender, with smooth margin and no fixity to overlying skin or the underlying chest. And the nipple areolar complex were unremarkable. A clinical diagnosis of fibroadenoma was made considering the age and age of the patient and nature of the swelling. And following which the patient was advised for ultrasound breast and also fine needle aspiration from the swelling in the right breast. What ultrasound showed was a well-defined heterogeneously hypoechoic to hyperechoic lesion which measured 2.3 into 2.2 centimeter in the right breast, and it was located 5 to 6 centimeter from the nipple areolar complex. So radiologically also a diagnosis of fibroadenoma was made. So here you can see this is the lesion and it was given due to some irregularity, and this it was given a BIRAX 3 category on ultrasound suggestive of fibroadenoma. So here is the swelling in the right upper outer quadrant of breast. This is the USG image. So when we got the patient for doing the procedure, we did fine needle aspiration, and on fine needle aspiration, we got milky white fluid, no blood or blood mixes, plus blood mix cellularity was obtained. It was milky white fluid with whitish flakes in between. I'll show you the image also. And these smears were prepared from the milky white fluid and stained with Giemsa and Pap stain. And what we examined under microscope to say that yes, the origin is from the breast tissue, we need to find the ductal epithelial cells. So in these slides, though the epithelial cells were very few, but we got occasional groups of benign ductal epithelial cells and along with few scattered bipolar nuclei. So that rules out any malignancy in the patient because our ductal epithelial cells were benign. So see, this is the gross image of the fluid what we aspirated. This is milky white with whitish flakes were there in between. So this is the gross image you can see of the material which we obtained on FNA. And as I said we got ductal epithelial cells in cluster. So you can see very well defined round to oval ductal cells है इसमें. So there is no atypia, no irregularity in the cells, no pleomorphism, nothing. All the cells were bland looking. And what important thing was noted in background of these smears, what we saw were numerous macrophages along with amorphous granular proteinaceous material and frothy appearing micelles. I'll show you the image also. And along with that, so this amorphous granular proteinaceous material in the background along with what we are getting is oval, round to oval shaped crystals in a fibromyxoid stroma. So see, this is the micelles formation, like frothy appearing background, correct? So these are these are you can see. So background was proteinaceous granular frothy appearing. So here also it is the same picture. And somewhere you can see, I'll show you the image of crystals is also as well. This is the low part. You cannot appreciate crystals much in this image. So here you see. So all these are variably sized crystals what we are getting in the smear. See. So all these are the crystals. Variably sized oval hai, angulated. rectangular, all the same shapes. So this is under oil immersion image. So clarity of the crystals are more. So here you see this is a crystal, this is a crystal. So small are there, different size के हैं सारे. So variably sized crystals were seen on these smear. So what we got? Ductal epithelial cells मिल गए. That defines that your FNA is from breast tissue. Fine. So parent tissue is identified. कि ductal epithelial cells है, benign looking है. There is no malignancy in it. And also what we are getting a background जो मिल रही है वो हमें proteinaceous, granular, frothy appearing with micelle formation. And also we are getting variably sized crystals, angulated, oval, small, large, सारे size के मिल रहे हैं हमें. So a definitive diagnosis what we could give on cytomorphology was crystallizing galactocele. Considering the age of the patient, history of pregnancy and lactation, I'll tell you later why it is important. So pregnancy, lactation की history थी patient को, well defined nodular, एक mass है right breast में. Cyto findings I have told you what we got. So what diagnosis was made on cytology is crystallizing galactocele. So now let's see what this entity is and why it is important. So see, swelling in breast is a very common finding which we get in our day-to-day FNA practice. So there are certain benign conditions जो mimic करेंगे malignancy से. और ये जो mimicking क्यों होती है? Because of certain physiological or pathological changes which is taking place in the swelling. So this could be due to some internal physiological or pathological changes. So the term जो pregnancy और lactation में जो mass बनते हैं that is your galactocele of breast. It is a benign cystic lesion है. Usually हम इसे note करते हैं patient में during pregnancy and lactation as was noted in our patient. So now why this entity is so particular for this group of female with history of pregnancy and lactation. So this could be numerous factors can attribute to it like stimulation of your prolactin hormone during pregnancy, then because of secretory breast epithelium, obstruction of lactiferous duct which is causing the accumulation of the milk inside, and really it can be found in some nulliparous women as well also with features of prolactinemia जहाँ prolactin formation ज़्यादा हो रही है, also in postmenopausal, but usually the age group is your pregnancy and lactation females. So this is cystic collection of your milk product and which is lined by a flattened cuboidal epithelium. इसीलिए हमें इसमें cellularity ज़्यादा नहीं मिलती, proteinaceous background मिल रहा है हमें, ठीक है, frothy appearing micelle formation वो मिल रही है. Now clinically how the patient will present to you with a solitary freely mobile lump होंगी, usually in the subareolar region, and due to physiological changes और physiological change होती है जैसे pregnancy में there is enlargement of the breast glandular tissue, so एक छोटा lump होगा, it will not be easily detected, so the patient can also miss it with during self examination of the breast also they may not be like finding this swelling, so due to physiological change the diagnosis becomes a challenging task. So clinically, as we saw in our case also, clinically and radiologically, in our case also the diagnosis was given as a fibroadenoma because you cannot make a definitive diagnosis because the picture resembles so much like fibroadenoma. It's a freely mobile lump or sometimes due to history, जो pregnancy or lactation की है, the clinician can give a diagnosis of lactating adenoma. Radiologically, depending on the content, अगर वो cystic है ज़्यादा तो on radiology the diagnosis can be given as abscess, solidify हो रहा है तो can be given as fibroadenoma, lactating adenoma, or sometimes due to irregular margin or something they can be given as pregnancy associated breast cancer also. So we need a proper pathological diagnosis to confirm what is the entity for early intervention and wave off undue tension in the patient. So now these galactocele, अब why this is rare? Galactocele जो हमने पता just now I told you that it is seen in pregnancy and lactation group, lactating female group. So why it is important? अगर ये galactocele long standing रहता है, gradually what happens? There is crystal formation inside these galactocele. So ये बहुत rare है, it is not common. So very few cases of crystallizing galactoceles of breast have been reported in literature on FNAC. So in all case there could not be like no definitive opinion could be given on the clinical or radiological background, and milky white जो fluid होती है जो accumulate हो रही है galactocele में, so that act as a bed for these crystals to form and deposit inside those swelling. So these secretions जो होती हैं, these are composed of your acid and neutral mucin, lipids, lysozyme, albumin and immunoglobulin A. So under acidic environment क्या होता है? There is super saturation of these substances and these can land up in formation of different type of crystals like your tyrosine or calcium crystal. Gradually इसीलिए क्या होता है, जो cystic mass होता है, it gradually becomes your form too hard and at times they can mimic malignancy also अगर बहुत enlarge हो जाती है. Hence, a timely diagnosis is warranted. Why? Because early intervention, proper intervention, and undue tension in the patient can be waved off. So this is, as I told you, grossly collection होगा ये inspissated lactational secretion, mainly fat and protein. That's why your cytological background is so frothy and micelle formation is there. So on cytological evaluation, I showed you images of cytology. We see dense amorphous proteinaceous material along with ovulated, oval angulated crystals of various sizes. Now on polarizing microscopy, if we see, we get birefringence. Or just depending on the type of crystal, special stain can be used like periodic acid shift or von Kosa stain can be used to highlight these crystals if these are not prominent. But in our case, it was very prominent, so we need not use these stain also. So this course जो होती है, course and outcome of crystallizing galactocele obviously एक benign entity है. So and this will not require major surgical intervention. ठीक है, initially diagnosed, you can aspirate also, so undue surgery can be avoided. So they sometimes resolve of their own and sometimes they can be therapeutic aspiration may be required depending on the size, what compression effect it is causing, what patient is having the symptom. So this was the rare case which I wanted to discuss with you all. So to take home message क्या है हमारे इस case से, that crystallizing galactocele of breast, it should be considered as an important differential diagnosis while we evaluate any breast mass in pregnancy or lactating females. See, only clinical and radiological findings will not be sufficient enough to help us in helping us to arrive at a definitive diagnosis. So a proper pathological diagnosis is mandatory and course and management of this crystallizing galactocele of breast is smooth and major surgical intervention is not required in majority of cases. So that depends on the symptoms of the patient. So thank you so much for your patient hearing. So kindly like, subscribe and share my YouTube channel Patho with MK. Thank you so much.